Hi, Dr. Kevin Connors here again today for your Members Minute. We've been talking about Lyme disease and we're going to continue. So Lyme disease. And mainly we're talking about chronic Lyme disease. So with chronic Lyme disease, we talked about it goes into an autoimmune phase. So remember, if you watched any of my autoimmune videos, you have two sides of your immune system. You have your Th1 side and your Th2 side. This is normal. So normally your Th1 side fires to kill a pathogen. I got exposed to a virus, Th1 side fires, kills the virus, I go back into balance, I never knew I had a virus. So in the event that it's a really bad virus, a really bad flu or bad something, my Th1 fires, and understand with this Th1 side and Th2 side, there are all these different chemicals. In this Th1 side, it's the specific cytokines and chemokines and lymphocytes and white blood cells and macrophages that are the killers. Think of these guys as the Marine Corps. They're out to kill the pathogen. That's what their job is, and they do it well. So they're firing to kill that pathogen. If it's a really virulent virus or something like that, and they're not able to kill it, then this suppresses, this goes down, and the Th2 side fires. Think of the Th2 side as the CIA or the FBI. They're out to find Al-Qaeda. They're out to find the terrorist. They're out to find the bad guy, and they're going to tag it with an antibody. So Th2 side primarily makes antibodies to kill that virus. Then that suppresses, and then the Th1 side fires again. Now it can tell, oh, there you are, you little stinker, we're going to kill you. Fires a reaction against that pathogen that's tagged with an antibody, and it kills it, and it goes back into balance. You were sick for 3 days, and you go back to work, and you're all happy. Well, the problem is with an autoimmune issue is that this is still not able to kill that Lyme disease because it's hidden intracellular. It fires a Th2 reaction to go and tag the Borrelia. It can't find it. It's hidden intracellular, so it starts tagging your cells. So in this case, with an autoimmune, you make antibodies against your own cells. Not good. When you start making antibodies against your own cells, that's called an self-immune disease. Your body's immune system is destroying self-tissue. Why? Because it couldn't find the antigen. It was hidden somewhere, or the antigen wasn't even a living thing in order to be killed. So the immune system creates antibodies against your own cells, and you start destroying self-tissue. This is what happens with all autoimmune diseases. That's what an autoimmune disease is, but it certainly happens with chronic Lyme. So people that are chronic Lyme are stuck in an autoimmune reaction. On our next videos, we'll talk about where's the imbalance, but it's important to know this piece first.